Hi, Assalamu alaikum. Hi, good evening and Assalamu alaikum. This is Dr. Sadaf Hammad here. And today we will discuss that about the framework or the outline of history taking station, the station 2 for the basis exam. Okay, so everyone knows that there are 5 stations for the basis exam, and this history taking station, the station 2, it carries 20 marks and 5 skills are assessed here. This audio is especially for the candidates whose first language is not English, and they find it very difficult that what particular questions to ask to rule out or confirm or to analyze the specific symptom or complaint. Okay, so first we will discuss that what station 2 is and how this one faces in the exam, and then we will discuss that what should be the scheme, and then we will discuss that what questions need to be asked and how that question need to be asked. All right, so this station, as I told you, that 5 skills are assessed, and these 5 skills are: first one is clinical communication, second one is clinical judgment, third one is patient welfare, fourth one is patient concern, addressing patient concern, and the fifth one is differential diagnosis. Right, and each skill it has 4 marks, and it is usually marked as satisfactory, borderline, or unsatisfactory. So when you get satisfactory, it means 4 out of 4. So what every skill is about? For example, let's talk about the clinical communication. The clinical communication is basically how we communicate during our history. And if we talk in a very fluent, professional, and respectful way, and analyze the presenting complaint, take the past history, the medication history, the family history, and as well as the social history, and the impact of the disease on the impact, and definitely address that, the impact of the particular disease or condition, patient's life and job, and you help the patient dealing with this. It all comes under the heading of clinical communication. So if we cover all this, you get satisfactory marks in clinical communication. Next one is clinical judgment, that how you interpret all the given information that has been given by the surrogate and whatever the questions you have inquired about, and that is the clinical judgment. You make a proper management plan and tell the patient and discuss with the examiner that how you will investigate and treat that particular condition. And it also includes, for example, the patient is having any condition which is excuse me, which is the side effect of any medication, and you need to stop that medication. That also comes under clinical judgment. Suppose if any medication that is causing any side effect and you do not stop that medication, and for example, patient is having any acute emergency and you do not admit the patient, then you will lose your clinical judgment. So this is how the clinical judgment is assessed. Next one is the patient welfare. There can be any sequence. You can write in any sequence, but these 5 skills are assessed. Patient welfare is then we do not do any harm to the patient and do good to the patient, treat the patient respectfully, and show empathy and sympathy in station 2. That is the patient welfare, and do the safety netting of the patient. That is the patient welfare. Next one is the patient concern. So it's a very easy skill for the candidates who are residing in the UK, because it's their usual practice to ask for the concern and the address in the layman term. But for the international candidates, they have to make some extra effort for this skill. So for the closure and asking the concern and addressing the concern, I have made another audio. You can listen to that, and that is very helpful. And I have discussed in detail that which points to be included while doing closure of the any scenario, especially for the station 2 and 5. how to ask for the concern, how to tell the particular disease, and how to offer the management plan to the patient. So you can listen, you will get an idea about that. So regarding the concern, we will ask the concern, and you should ask the concern so loudly that examiner may hear that you are asking for the concern, right? And then appreciate and address the concern. And after one concern, ask for the another concern from the patient, right? Okay. So if you address the concern directly and in a polite way, then you get satisfactory marks in it. But for example, patient is asking that, is it cancer? And you just talk about here and there and do not tell the patient that whether it is or not, because you are not sure yourself, but you are not telling the patient due to any reason, or you're not answering, you are just skipping the concern, then you will lose that skill. So overall, in the patient concern, you have to secure 10 out of 16. So you cannot lose this skill in, because it is assessed in 2, 4, and 5. So you cannot lose this skill. Okay, otherwise you will lose your exam. So put extra effort while preparing for that. For the practice, you can just set the timer. For there are few diseases I have shared in a group the diseases, the common diseases for the clinical judgment, the investigation and management plan. There are few diseases you need to memorize. So you can do the closure. Closure is usually done in a layman term. Do not use the jargons. Do not use the jargons, right? You will cost your marks. Negative marking would be. I mean that your marks will be deducted and you will be marked as borderline. So do not use any jargons. Jargon means do not use any medical term. So you can practice with 2 minutes, telling the for practicing about the common conditions. Okay. Then comes the yes, we have discussed clinical communication, clinical judgment, patient welfare, concern. Next one is the differential diagnosis. While telling the differential diagnosis, summarize your positive data from the history which you have interrogated from the patient. And if there is any important negative, be crisp and be fluent and be concise and precise when summarizing your case. It puts a very good impression to the examiner, right? So summarize your case with the positive finding, or if any other one or two just negative, if you want to add, you can add, then you will present that this is my probable diagnosis. And for the history, at least give 3 or 3 plus differential diagnosis. But for every differential diagnosis, either you have to give the points in favor or against of that diagnosis. So in this way, you will present your differential diagnosis. Okay. Now let's move to that how to take the history. There are few, you can say the parts of the history taking or few domains. Okay, so first one is history of presenting complaint. First one is introduction. The next one is analyzing the presenting complaint. The other one is the past medical history, then the medication history, then the family history, and the obstetric history, and then the social history of the patient. And for the review of the system, either you can do the review of the system before asking for this family and social history, or you can ask before the past history if you haven't made any diagnosis while doing the analysis of the presenting complaint. It's up to you. Okay, so you can change the review of system, right? So how we will do this particular station? Yes, first of all, we will introduce. For example, when I enter this station, and yes, outside we will have the 5 minutes. Okay, we will have 5 minutes to prepare the scenario. There's a scenario outside the room. Some informations are given. Sometimes there's a long scenario. The information is given. What should you do? There's a paper and a pen. Note down the name of the patient there, age of the patient, your designation, and where you are seeing the patient. Either it is a medical assessment unit, or it's an emergency ward, or it's a gastroenterology clinic, or the rheumatology clinic. Note it down outside, name, age of the patient. Okay. So what is the significance of looking your place of interview is that, for example, you are working in a gastroenterology, it is written outside that you are a doctor in the gastroenterology clinic. and the patient came to you with complaint of tummy pain there. So at the end, when we will tell the patient that we are going to involve different specialists, so we will not refer to the patient for the gastroenterology clinic. We will just say, I will involve my consultant. So it carries this significance, right? For example, you are in a rheumatology clinic and patient has rheumatoid arthritis, and also the patient is having the respiratory complaint due to fibrosis, pulmonary fibrosis. So in that case, we are sitting in the rheumatology clinic. So we will involve our consultant and involve the pulmonologist for the pulmonary fibrosis. Okay. So how we will do? We'll do is hello, good morning, good evening, whatever your carousel is. Suppose it is morning, so I will say hello, good morning. I am Dr. Sadaf Hammad, one of the doctor in the clinic today. Just to be sure that I'm talking to the right person. Are you Mr. Ma? I'm 38 years old. And then wait for the answer of the patient. Okay, the patient will say, yes, I am. So then greet the patient, nice meeting you. So wait for the patient to respond back. So it's not a good practice that you just keep on saying your lines and don't wait for the patient. So wait for the patient. So after this introduction, confirm the identity, we will say, I have got, there are two options. It's up to you. The people who are not, who are very fluent in English, they can use any sentences. This is especially for the candidates who find it difficult to find some word or sentences. Okay, so we can say that I have got a letter from your GP that you have some tummy pain, right? So please tell me more about it. Okay, or you can say that I understand that you have some tummy pain. Please tell me more about it, right? Or suppose in the scenario there are a complaint that patient is having headache and some high blood pressure. So we can say, I understand that you have headache and some high blood pressure. So let's talk about your headache first. Okay. So we have confirmed with the patient that the patient is having, we know that the patient is having, and we are letting the examiner know that we have noticed that patient is having headache and high blood pressure. But first we will explore and analyze the complaint, then we will move to the next complaint. Okay, and for the analysis of the presenting complaint, there is a worldwide mnemonic that is the OTPARA. Okay. So O is for onset, D is for duration, P is for progression, and A is for aggravating factor, R is for the relieving factor, and next A is for the associated symptom. So how we will ask for the onset, we'll ask for how long you have this problem, how it started, suddenly or gradually. Okay? And the next question would be, for how long you have this problem. The next would be, is it getting worse with the passage of time? And have you noticed anything which makes it worse? And have you noticed anything which makes it better? Okay. Then we will do the associated system, right? This is for any of the presenting complaints. But if the patient is coming to you with a presenting complaint of pain, so then the the mnemonic is Lokira. LOQIRA. L is for location, O is for onset, Q is for character, I is for intensity, R is for the radiation or the relieving factor, and the relieving factor, and A is for the aggravating factor and the associated symptoms. So for the location, we will ask that where exactly the headache is, and how it started, suddenly or gradually, or suppose the patient is having chest pain. With the pain, we will ask one more question, that is about the trauma. For the sudden onset of any of the presentation, we will add the question of what you were doing at that time. So how it started, and if the complaint is of sudden onset, we can ask that how it started, what you were doing at that time. And is it for the first time you're having this problem? Right, and then we will ask about how your pain feels like. Okay. And if patient is unable to describe you can give the option of, can you describe the pain for me? Is it throbbing? Is it something pen-like? Is it sharp or dull? In this way, you will or see the character of the pain. Next one is intensity. We can ask that, can you tell me how severe your pain is? If 0 being no pain and 10 is the most severe form of the pain, can you grade your pain? Okay. So patient will tell you either he's having 3, 4, or if it is more than 5, 6, so it means that patient is having some trouble. So you will offer that. Do you need any painkiller right at the moment? Definitely patient will refuse, but you need to offer that. Do you need any painkillers at the moment? Patient will say, no, I have taken, so there is no need. So this is the patient welfare here. Then we will ask for the radiation. Does your pain go anywhere? Excuse me. Does your pain go anywhere? Okay. That is the radiation. Or if patient is not getting your point, you can specifically ask for the headache. You can ask, does your pain go in your neck? Okay. Or for the chest pain, we can ask, have you noticed that is it go in your arms or in your neck or through your back? So in this way, we can ask. For the aggravating factor, we will ask anything which make it worse, anything which makes it better. And for few pains, like for the pain of pericarditis or pleuritis, we can prompt the patient by giving the options that does your pain worse on breathing or on movement, or have you noticed that it becomes better on leaning forward? So in this way, you can give options to the patient to make your diagnosis very early. Okay. And there comes the associated symptoms. What is the associated symptoms? For example, if you are dealing with any complaint of the neurology, any vision problem, any headache, any weakness in any part of the body, or any history of fits, so it means that we are dealing with a neurology system. So there are 14, 15 questions for that. So we will ask that after doing the analysis of the presenting complaint, we will ask that question from the system. In history, we have to ask especially the associated symptom in more detail. We need to ask all the questions. Okay? And if it is from the respiratory symptoms, we will ask about the symptoms of the shortness of breath, cough, chest pain, all this. So in this way, we will ask a question for the associated symptom. If you need, I can tell you the question, how to ask that question and what are the questions need to be asked for the particular system. Okay. Then comes, I have kept the next heading is of, after doing this history of presenting complaint, we will ask for the constitutional or the general symptoms. I have kept, you can say, 7, 8 questions in that category. First one is, have you noticed any high body temperatures? That is, these are the fever, fatigue, weight changes, rash, joint pain, lumps or bumps, night sweats, sleep and mood. Then again, for the candidate who find difficulty in looking for this words or sentences, for the fever, we will ask, have you noticed any high body temperatures? For the fatigue, we will ask, do you feel tired? And if it is relevant, then we will go in detail, otherwise no need. Is to see the myasthenia gravis and other fatigue. Is it all the time or any particular part of the day? Okay. So next one is, have you noticed any weight changes? Rather than asking for any weight loss or weight gain, I have observed that it is better to ask for any weight changes you have. The next one is, have you noticed any skin rash? Next one is, do you have any joint pain? So in this way, when we make pet sentences, there are 2 advantages of this. It saves your time. Okay. So because I have seen some candidates, they are looking for the words and it takes time. So whenever you are practicing with your study partner, try to finish your history in 12 minutes because the real exam and the surrogate takes time to answer your question. Okay. Then guess we'll ask, and the other advantage is that I have also observed even while preparing that candidates who have not practiced a lot, Sometimes they are just looking at what they're concerned more about, that what next question they will ask. Okay, what they are lacking in the scheme, rather than interpreting the data the patient is giving to them. So if you practice with these pet sentences, you can make your own sentences. So it's not any hard and fast rule. I'm just giving you the idea. So just make for the history, just make outline your own words, your own sentences, but memorize that, so it will save you time. Secondly, the question would be at your spinal level. So you will not have to look for the next question. Rather, you will be concentrating and extracting from the information the patient is giving to you. Okay. So for the general or constitutional symptoms, we have asked about the fever, any high body temperatures, any fatigue you have, or any tiredness you have noticed, any weight changes you have. Okay. And the other one, any rash you have. And have you noticed any joint pain or any lumps or bumps on your body? Okay. And do you have any night sweats? And what about your sleep? And how is your mood nowadays? Okay. So these are the general or the constitutional symptoms. They help in to for the confirmation of the inflammation or infection, or sometimes they give a hint to make a good diagnosis. Okay. So till now we have done the introduction, confirm the identity of the patient, taking consent for the meeting. Okay. And in the very beginning, when patient told you, yes, I'm having this joint pain or this, so show empathy. I'm really sorry to hear this, and I will definitely try to help you out. And for this, I need to ask you some questions. Okay. So this is the opening of the history session. Then we have done this analysis of the presenting complaint, then the associated symptoms, and next we have done the constitutional symptoms or the general symptoms. Right. Now further is your choice. Either you want to do the review of the system, you can do it. You can do the review of the system, or you can take rest of the history and do review of the system at the end. If till now you haven't made any diagnosis, or you are not sure, or you want to rule out the complication or any differential, so do review of the system here. So the questions you have asked earlier, do not repeat that question, because repeating the question, examiners, they do not like this. So again, if you have memorized your scheme and you have practiced a lot, so definitely you will not repeat your question. So while taking history, take it in a systematic order, starting from the in general. Also keep one question of any source in your mouth, or sorry to ask you, any source in your private parts. Okay. So these questions we have asked. Review of system is next, comes the chest. In the chest, we will ask, do the review of system of respiration and heart as well. Then for the review of system of GIT and as well as the kidney. Sorry, review of system of GIT and the kidney. And lower limb we have already done with the neurology. Okay, in this way we'll do. After the review of the system, we will just move to the past history. And for the past history, we can ask that, do you have any medical problem in the past? Or if you think that diabetes or hypertension can be relevant, you can ask it, have you noticed any high blood sugar or any high blood pressure? Okay. Or any relevant history, if you think that can be relevant, you can by name ask that. Then if the patient gives you positive family history, at the same time, without wasting any time, ask for, can you show me your medication list, please? And see the medication list, and then ask 3-4 questions about the medication list, that for how long you are taking this medicine? Are you compliant? Are you taking your medicines regularly? Okay. Any recent change in your medications or any new medications you have started? So if any scenario is related to the side effect of any medication or interaction of any medication, so you will get hint from there. Okay. And after the past history, the medication history, we'll ask, do you have any allergies? If we are dealing with a scenario of respiratory symptoms, it has significance here. Or if we are going to start the patient on any antibiotic, for example, in a case of meningitis or any infective endocarditis, we can specifically ask for the drug allergies here. So after past history, medication history, allergies, then we will move to the family history. For the family history, we can ask the question like this, that any particular health problem which runs in your family. Or if we are dealing with a patient of cardiac symptoms, then we can ask any history of heart problem in your family, or any history of cancer in your family if we are suspecting some cancer in the patient, or we are dealing with a GIT complaint and we think that patient can have the concern of the cancer. Okay. Or for the cardiac patient, we'll also ask any history of sudden death in your family. If patient gives you any of these gross or serious conditions in the family, say, I'm really sorry to hear this. Okay. If there is loss, I'm really sorry for your loss. So empathize here. Okay. Then after the family history, if we are dealing with the female patient, we will ask for the 3 Ps. First is for the, what about your monthly periods? And are you taking any birth control pill? And the third one is any chances of pregnancy at the moment? Or if our scenario is about the clotting problem, so we can ask any history or for the vasculitis, SLE or antiphospholipid or pulmonary embolism. So we can ask that I'm sorry to ask you, any loss of pregnancy? Okay, so in this way we'll ask the patient. And then comes the social history. And the same with the male patient. Female patient, we will ask 3 Ps. And for the male patient, first of all, we will do signposting and take consent. I'm going to ask you some personal questions. Is that okay with you? I assure you that everything will be kept confidential. And here you will take the sexual history. If it is relevant, you need to take that in more detail. Okay. Then comes the social history. And the social history will ask about the job of the patient. Okay. And what is the impact of how you have been affected by this problem in your daily life and at your work. If patient is affected, offer help here, that there is a lot of help available. We can help you with this. And for the home, we can offer the social services, and for the job issues, we can involve either we can deal it if it is a slight problem, or we can involve the occupational health department or occupational health physician. Okay, then we will ask about the smoking, and alcohol and recreational drugs. And how to ask for this? For the smoking, we'll ask, do you smoke? And how many cigarettes in a day, and for how long you are smoking? Patient tell you, address at the same time, because it is part of the problem list we have to address at the end. So sometimes you forget due to stress of the exam. So when patient tells you that, yes, I'm smoking this one, so you can say smoking is not good for health. I strongly advise you to quit smoking. And for this, a lot of help is available. Okay. In this way, we will politely tell the patient that it's not safe, so it's better to quit. There is help available. Okay. And next one is about and one thing more. Suppose the patient, you think that the patient problem is due to smoking. Patient is having long-standing cough, and patient says that I'm not smoking. So in that case, you will ask, have you ever smoked? Maybe patient has stopped smoking 1 month back, few weeks back, and now he tells you that. Definitely, he will tell you that I'm not smoking, because he is happy that he is quit it. So here you will inquire, have you ever smoked? It's really appreciated that you have stopped smoking. Then you will say this. Okay, then comes for the alcohol, we will ask if it is relevant, we will ask the question in more detail. Otherwise, we'll ask, do you drink alcohol? Okay, and 14 units, it's a recommended limit. If the alcohol is not related to a scenario, you can just say alcohol 14 units, it's a recommended limit. So it's safe to drink within this limit. Okay. For the recreational drugs, if it is relevant, you think, so you can ask, I'm going to ask you some personal questions. I ask all of my patients, do you take any party drugs? Okay. And same, if you think that patient may be IV drug abuser, or we are looking for the risk factor, then we can again take the consent and signpost. I want to ask you some personal questions. Have you ever taken any drug through your blood channel? So in this way, we will ask politely for the IV target research. So till now, we have discussed that we will do the introduction, confirm the identity, take the consent to start the meeting, show the empathy, sympathy, do the analysis of the presenting complaint. Okay, then associated symptoms, then the general or constitutional symptoms. Then we will ask for the past history, then comes the medication history, and then allergy, then the family history, then obstetric or sexual history, then the social history. Okay, so you can make any mnemonic for that. Then if till now the examiners haven't prompted you that 2 minutes are remaining, be vigilant. With practice, you will exactly know that how much, without saying as the what, you will know that how much period have been elapsed. So if till now, if the examiners haven't prompted you, so you will just recap what you have extracted from the discussion with the surrogate, just the positive things or any other important negative. Okay, so you will summarize to the patient and ask, do you think that I have missed anything important and you want to add? Maybe patient, if you're missing something, he will add, okay, because they have a script. So you will be lucky if the candidate surrogate, sorry, not candidate, surrogate or patient, he gives you the hint, yes, you have missed this and it was important. So then you will ask for the concern that do you have any concerns? Patient will tell you, I'm concerned about this. Appreciate it. I really appreciate your concern, or your concern is quite genuine. And we will do the closure as we have discussed. Okay. So I really appreciate, and it look like or it doesn't look like. In this way, you will address the concern. You will tell in the layman term that what the patient is having. You will tell about the admission and roughly the management plan. So I have already shared in the group, so you can see hear from there. So if regarding any specifics, I will make definitely an audio for all the system that what question need to be asked and how to ask that particular question. So thank you very much for being with me. If you have any question, you can post here. So thank you and Allah Hafiz.